Welcome to a new episode of Medicine in 3 minutes. As usual, we go straight to the point. The subject is bravely made clear and often illustrated. Today's topic is about leukomoid reaction, leukemia, and lymphoma. The normal account of white blood cells is between 3,000 and 11,000 per microliter. Less than 3,000 is leukopenia, and over 11,000 is leukocytosis. White cell proliferative disorder, there is two types of white cell proliferative disorder: a reactive disorder and neoplastic disorder. A reactive disorder, there is two. There is leukocytosis and leukemoid reaction. Neoplastic disorder, there is leukemia and lymphoma. How to make the difference between leukocytosis and leukemoid reaction? Hematopoiesis production of WBC. In bone marrow, there is a bone marrow storage of pool of WBC. In circulatory system, there is a marginal pool of WBC. When there is a stress, like inflammation, infection, or trauma, first there is a mobilization of marginal pool, and this causes leukocytosis. If there is mobilization of bone marrow pool, overcivilization causes leukomoid reaction. Leukomoid reaction, WBC over 50,000 cells per microliter. White cell proliferation disorder, it gives a reactive disorder and neoplastic disorder. A reactive disorder, if it is a mild or moderate increase of leukocyte, it's leukocytosis, which it could be neutrophilia if infection, eosinophilia if parasite, basophilia if allergy, and monocytosis if mononucleosis infectious, lymphocytosis if tuberculosis. Leukomoid reaction between 30 to 60,000 per microliter. Neoplastic disorder, it could be leukemia and lymphoma. To make the difference between leukomoid reaction and chronic myeloid leukemia, in both there is an increased production of granulocyte coming into the circulation. But leukomoid reaction, WBC, are normal. A leukocyte alkaline phosphate is high. That means leukomoid reaction. If leukocyte alkaline phosphatase is high, that means leukomoid reaction. If leukocyte alkaline phosphatase is low, that means chronic myeloid leukemia. Leukemoid reaction, WBC, are normal. Leukocyte alkaline phosphatase alkaline is high. Chronic myeloid leukocyte leukocyte alkaline phosphatase is low. Leukomoid reaction blast cell never go over 20%. In leukomoid reaction, blast cell never go over 20%. For leukemia, there is two types: acute myeloid leukemia, AML, and acute lymphoid leukemia, ALL. Acute myeloid or lymphoid leukemia, immature malignant cell called blast jump into circulation. To tell leukemia, more than 20% in the bone marrow is leukemia. They also are present in circulation. Hematopoietic precursor cell in bone marrow. Normally, proliferation of precursor cell is well controlled. In leukemia, there is excessive, uncontrolled, unregulated proliferation. In leukemia, there is excessive, uncontrolled, unregulated proliferation. Normally, there is a proliferation of precursor cell which is well controlled, and regulated. When precursor go to the circulation system, like spread like milk, it's leukemia. If it's spread like butter, it's lymphoma. If it's spread like milk, it's leukemia. If it's spread like butter, it's lymphoma. Spread of blast, leukemia spread like milk, and lymphoma, it's a piece of butter. Leukemia is a neoplastic malignant proliferation of hematopoietic precursor cells, myeloid or lymphoid. Normally, proliferation of cells is well controlled. In leukemia, there is excessive, uncontrolled, unregulated proliferation. If malignant cells diffusely involved in the bone marrow and tendency to spill into circulation in a milky way, this process carried out by malignant cell is called leukemia. Leukemia is if hematopoietic precursor cell, it doesn't matter it is myeloid or lymphoid line. If they undergo malignant transformation, they are no more sticky to each other. They diffuse and spread. They are not localized in the bone marrow. They jump into circulation. Some cells undergo malignancy, but cells are attached to each other side by side. They do not diffuse into circulation massively, but they form small isolated islets scattered in the tissue, lymph node, lung, thymus, liver, GIT, brain. Like making small piece of butter, we call them lymphoma. The real difference between leukemia and lymphoma is the way they spread and the way they clinically present. Precursor becoming malignant and spread diffusely in bone marrow with tendency to jump into circulation. Cells are spaced apart from each other and not glued, leukemia. But the same cells are glued to each other and now spaced apart from each other and form no diffuse small isolated islet. Scattered in the tissue, they are called lymphoma. Leukemia or lymphoma are proliferation of malignant precursor hematopoietic cells. The difference is what is the tissue presentation of patient when he comes to the doctor. Coercive mass lymphoma butter, widespread leukemia milky. Lymphoid tumor can be leukemic or lymphoma. Sometimes disease starts as leukemia. With time, we find a big lymph node, milk converted into butter. Or patients that came originally with lymphoma, if not responding to treatment over a few months or years, go into leukemia phase. There is interchangeability between lymphoma and leukemia. Thank you for watching this episode of Medicine in 3 Minutes. Make sure to click the button like and subscribe. Your comments are very welcome. Thank you.